Well, we're going to quickly move on. For weeks, so many citizens concerned at the deteriorating condition of the 23-year-old rape survivor hoped that somehow she would pull through to be fit for an intestinal transplant. It's an immensely complex surgery, and now, just a few days after a death in Singapore, it's been performed successfully on a patient in India for the very first time. The patient, a 30-year-old software engineer, Himanshu, is ready to leave hospital about 6 weeks after his 10-hour surgery. Well, joining us now, the man who performed the surgery, Dr. A.S. Soin, who led a team of 30 doctors who conducted this historic operation. With him, J.P. Singh, the patient's father. Thank you both very much for joining us. Mr. Singh, you must be very, very relieved. We've all read about this, we've discussed this so much. But when your son went into that OT, you must have been a very worried man.
Yes, definitely I was very much worried, but I had got full confidence in the team of doctors of Medanta hospital, who have in fact given me courage to go for intestinal transplant in India, and I am very much relieved and I am very much satisfied. It is a successful operation. Since last 3 years I faced lot of problems. My son was hospitalized for more than 10 times for infection or any other problem. But now, after 3 years of harrowing time, I have got a sigh of relief, and I very much thank to Medanta Hospital for carrying out such a complex surgery.
Dr. Soin, tell us this. You've got, your record speaks for itself, 1,500 liver transplants. So one is obviously speaking to a doctor who got into this knowing every aspect of this in a way in which none of us can imagine. But sir, tell us today, do you believe that if her condition stabilized, the 23-year-old who died in Singapore could have been saved through a surgery like this here in India? Did she necessarily have to go to Singapore?
Vishnu, I've said this before on NDTV about a week ago. She was quite far away from being a candidate for intestinal transplant. If you take the example of Himanshu, he's like his dad said, he's actually suffered for 3 years, and after his initial illness, he was on total parenteral nutrition or intravenous nutrition for about 2 years, and he lost about 35 kilos of weight. And he wasn't doing well on total parenteral nutrition in terms of having repeated infections, hospitalizations, change of catheters. So it's that kind of patient who has lost their intestine but do not do well on TPN that eventually become a candidate for a transplant. So, the unfortunate girl was quite far away from being a candidate for transplant. The immediate concern was that she had to get better. Her life had to be saved. By good intensive care, by good antibiotics, getting rid of the infection, by stabilizing her on total parenteral nutrition. Down the line, if she had survived, down the line, yeah, sure, 6 months, 1 year down the line, she may have been a candidate for intestinal transplant, but this is not something that would have saved her now. This is not done as an emergency operation.
Dr. Soin, now that you've completed the surgery successfully, Himanshu's been, he's been okay, relatively speaking, for a period of 6 weeks. Yes, everybody has ups and downs in their health, but do you believe that, you've saved his life, but do you believe that he'll have a normal life from here going on? Because this is at one level quite experimental. Till 2001 it was. So we don't really know the future in these cases, do we, Dr. Soin?
Well, the thing is that now intestinal transplantation is successful to the extent that about 60 to 70% of them will have long-term survival. That means 10, 15 years, and they live pretty normally, eating normally like everyone else does. Of course, there can be problems, but if you see what happened to him over the last 3 years, he wasn't able to eat a morsel without worrying if he'll have diarrhea or malabsorption or vomiting. And now when he was given some khichdi, he said even the khichdi tastes divine. So, obviously the quality of life will improve immensely.
Dramatically, yes.
And we hope that he will that he will carry on normally, live a normal life for many years.
And Dr. Soin, that's my last question to you very briefly. The reason you mentioned 10 to 15 years is because there isn't very much medical evidence at the moment, just because intestinal surgeries are relatively new. So there is nothing to suggest that the survival rates wouldn't go up indefinitely. Is that am I correct in my understanding?
You're partly correct, but what I would say is that if he has a smooth first 3-4 years, then it's very likely that he'll have a normal life expectancy, as you would expect any 35-year-old to have.
All right, Dr. Soin, thank you so much for speaking to us. And Mr. JP Singh, you must be a very relieved man. Thank you very much for being with us as well.
India's #1 news app just got even better. Download NDTV's new app. Fully optimized for retina display, full screen view, faster response time, and Sudoku. NDTV's new iPad app. Download now.